Together and consult your physiotherapist. The first exercise is neck flexions. Tuck your chin in and bend your neck forward and down to your chest as far as you can, then hold for 20 seconds. The next exercise is neck extensions. Tuck in your chin and slowly lift your head backwards to look upwards, and gradually let your chin untuck and let it out to full extension. Hold this position for 5 seconds and then slowly return to the start. Next, neck rotations. Turn your head to look over your right shoulder and hold for 20 seconds. And then do the same for the opposite side. Next, neck side flexions. Tilt your head to bring your right ear to your right shoulder. Keep your face looking forward throughout the movement and don't let your left shoulder rise up. Hold this position for 20 seconds and then repeat for the opposite side. Finally, neck retractions. Tuck your chin in by gliding your head backwards. Don't tip your head back or forwards. At the furthest back position, hold for 5 seconds, then relax to the neutral position and repeat 10 times. All of these exercises need to be done at least 3 times each day, ideally little and often. After several days, you should hopefully notice increased flexibility and possibly reduced pain generally. Remember, injuries when you grip, when you push down on your hand as follows, and get pain on this stretch, then you may have tennis elbow. You should also note tenderness when you press down on this spot on your elbow. If this fits, then this video should help you. A secondary effect of tennis elbow is stiffness and pain in the elbow joint, so you should stretch it out as follows. Flexion. With your elbow by your side and palm facing up, bend your elbow to bring your hand closer to your shoulder. Now use your opposite hand to push it for more of a stretch. Hold for 30 seconds and swap sides if needed. Extension. Rest your elbow on the edge of a table with a towel under your elbow. Straighten it out until it is fully straight. Now use your opposite hand to apply an extra stretch. Hold for 30 seconds and swap sides if needed. Pronation and supination. With your arms by your side and your elbows bent at 90 degrees, interlink your fingers in front of you, with your thumbs on the top. Now twist your hands so that your thumbs are pointing to the right. Hold for 30 seconds and then twist until they are pointing to the left, and hold for a further 30 seconds. Next, you need to stretch the forearm and tendon itself. With your elbow straight and your hand palm facing down, bend your wrist so that your fingers point towards the floor. Use your opposite hand to apply an extra stretch. Hold for 30 seconds and then swap sides if needed. You should do these exercises at least 3 times a day, or ideally little and often. You should try to avoid activities that irritate the area and increase your pain. Once you are settling down, then you need to strengthen the area gradually. Holding a light weight in your hand with your forearm resting on a table and your hand palm side down, slowly lower the dumbbell down towards the floor and then lift it back up towards the ceiling. Your forearm shouldn't move at all throughout, and it should be pain-free. Repeat this 8 times and swap arms if needed. As you get stronger, you must advance the resistance level gradually, but you can only advance if it is pain-free to do so. If you get worsening symptoms or are unsure, then initially reduce the portion to discomfort, and if this isn't enough, then stop altogether and consult your physiotherapist. The first exercise is knee rolling. Lying on your back with your hips and knees bent and the soles of your feet flat on the floor. Gently roll your knees from side to side while keeping your knees together, firstly in one direction and then in the other. Repeat this 10 times. The next exercise is single knee hugging. Lying on your back, bring one knee up to your chest, grab your knee and pull it so you feel a stretch. Hold for 20 seconds. Now swap and repeat with the opposite leg. Next, bilateral knee hugging. Lying on your back, bring both of your knees up towards your chest. Grab your knees and pull them so you feel a stretch. Hold for 20 seconds. Next, extensions in line. Lying on your front in a press-up position, use your arms to push up so that your lower back arches and your pelvis remains on the ground. Go as far as is comfortable and hold for 20 seconds, then slowly lower back down. Finally, side flexions in standing. In standing, lean to the side, taking your hand down the side of your leg. Make sure that the movement is purely sideways and that you don't bend forwards or back or twist at all. Take your hand down until you feel a stretch, hold for 20 seconds and repeat for the opposite side. All of these exercises need to be done at least 3 times each day, ideally little and often. After several days, you should hopefully notice increased flexibility and possibly reduced pain generally. To stretch the right leg, take a long stride forwards with your left leg. Keep both of your feet pointing forwards. Now, while keeping your back knee straight and your back heel in contact with the floor, start to bend your front knee and lean your body forwards until you feel a stretch in your back leg's calf. Hold for 30 seconds and then repeat for the other leg if needed. In a chair, prop your foot up on the opposite knee. Now take hold of your foot with both hands and pull your foot and toes up towards your shin. You should feel a stretch underneath your foot and in your calf muscle. Hold for 10 seconds and repeat little and often. It will help if you roll your foot over a cylindrical object such as a rolling pin or a cooled drinks can while seated. This will cool the area, but massaging it at the same time. Remember, one of the potential causes was foot posture. Here are some information to help you to work out what your feet do.
The back has two main parts, the back muscles and the spine. The spine consists of bones known as vertebrae, which are joined together by the facet joints and discs between each vertebra that act as shock absorbers. Risk assessment is required for all manual handling tasks. We use the TILE term to assess the risk. This stands for T, task, I, individual, L, load, E, environment. Never undertake a task that you consider to be a danger to yourself, your colleagues, and the patient. There are also environmental issues that we need to take into account, such as floor or surface conditions. Are they slippery, wet, obstructed, uneven or worn? Are there any steps or ramps along your route? Is there sufficient lighting? Heating conditions. Is it too hot, cold, or humid? If carrying or moving a load, is the load heavy, bulky, or awkward? Is it difficult to grasp, have harmful sharp edges, or is it too hot or cold? Is the load badly stacked or too high to see over? Lifting a load above chest height is also dangerous as you can't get the load close. You are less stable on your feet and it puts too much stress on your lower back. Get the patient to turn their head in the direction of the roll and place the patient's arms in the appropriate position. Near side arm flat against the body and far side arm placed across the body. Get the patient to bend their far knee if possible or cross the leg in the direction of the roll. Place one knee on the bed at the middle of the patient's torso, one hand on the patient's hip and the other on their shoulder. Now roll the patient towards you with a gentle but positive movement. Allow the leg on the floor to bend to facilitate the weight transference. With a colleague mirroring your actions on the other side of the patient, place one knee on the bed, facing the patient at their hip level. The other leg should be on the floor, slightly forward over the knee to ensure a good solid base. The patient should hold onto the carer's upper arms just above the elbows, and the carers should hold the patient's elbows. The patient should bend their knee slightly and tuck their chin into their chest. On command, the patient then pulls themselves up into a sitting position as the care workers lean back, sitting onto their heels. The care worker should be positioned close and slightly behind the patient. Place your hand on the patient's hip or lower back. Place the other hand on the front of the patient's shoulder or elbow, or get them to rest their palm in your palm. Your position will guide and reassure the patient as they walk.